Good morning, everybody. Pleasingly, as we know, New South Wales has hit the 86.2% first dose, 61.7% second dose, so we are inching closer to that 70% double dose figure. And pleasingly, 12 to 15-year-olds, 44.5% of them have already had their first dose, which is just outstanding given the vaccine was only made available a few weeks ago. To 8 p.m. last night, New South Wales had 863 cases of community transmission, and tragically 15 people lost their lives, and we extend our deepest condolences to the families and loved ones of all those who've passed away with COVID, and Dr Chant will go into further detail about those cases. Interestingly, our hospitalisation rate and ICU rate is doing okay compared to our modelling, so we're still just tracking under what we envisaged we would, but there's certainly no time for complacency. And I just want to again issue a cautious warning to everybody. We're all looking forward to the 11th of October. It's a day when we'll be able to do all those things we haven't been able to do for a long time. But between the 11th of October and when we hit 80% double dose, we do need to exercise that extra degree of caution to make sure that we don't see a surge in cases or a surge in hospitalisation beyond what we can manage. So I just ask everybody to think about what they're going to do in that week, think about the loved ones they're going to see, but just exercise that degree of caution. Interestingly also, we've seen a reduction in cases across Sydney, Greater Sydney, Western Sydney and South Western Sydney has seen a reduction in cases, but unfortunately an increase in cases in the regions, especially in the Illawarra-Shell Harbour region, and both Dr Chant and Minister Hazzard will talk about that. So we really need to keep an eye on some of the regional communities who are seeing a surge in cases. Pleasingly, the New South Wales Government is able to announce that from the 11th of October, aged care residents are able to welcome visitors, 2 fully vaccinated visitors per day. We know that for so many people, I'm looking forward to seeing my parents in that week, and for those of you who haven't been able to see a loved one for around 3 months, Monday the 11th, so long as you're fully vaccinated, 2 at a time, 2 per day, are able to visit a loved one in an aged care facility, and we know this is welcome news for so many people. And we again ask people to exercise a degree of caution. If you have symptoms or you're not well, please don't do it. We don't want to compromise the safety of your loved one or those around you. So again, a deepest gratitude to everybody who has come forward to get vaccinated. We noticed that both in the double dose figures and also in the first dose figures, you'll see a bit of a slowing down in how many we're getting every day, because obviously once you reach a particular point, that's the case, but we're confident we'll get to 90% by the end of next week in first dose, and we encourage everybody to come forward and get vaccinated. Don't miss out on all those things you want to do, and also please make sure you're keeping yourself safe, your loved ones safe and the broader community safe. Dr Chant will now give the health update, and Minister Hazzard will then talk about some additional matters, including what's happening in the regions. Thank you.
There were 863 locally acquired cases of COVID reported in the 24 hours to 8 p.m. last night, 3 overseas acquired cases, and 120,281 tests were performed. There are currently 1,082 COVID cases admitted to hospital, with 212 people in intensive care, and they span the age groups. In terms of the suburbs of concern, we still want to, whilst we are pleasingly seeing declines in case numbers, particularly in southwestern Sydney and Western Sydney, they're still starting from a very high point. So some of the areas of concern still remain: Greenacre, Marylands, Guildford, Yagoona, Blacktown, Minto. But we see the increase in cases in the Illawarra and Shoalhaven, particularly about that Wollongong and Shell Harbour area, and also we're concerned about Mount Druitt and Auburn. The key message is that we also are seeing some regional outbreaks, and Minister Hazzard will provide more details about the regional situation. Sadly, I have to announce the death of 15 people today, 7 women and 8 men. 2 people were in their 40s, 2 were in their 50s, 4 people were in their 60s, 3 people were in their 70s, 1 in their 80s and 3 people were in their 90s. 1 person had received 2 doses of the COVID vaccine, 5 people had received 1 dose of the COVID vaccine, and 9 people were not vaccinated. 5 of the people were from southwestern Sydney, 3 western Sydney, 1 person was from Newcastle, 1 person was Lake Macquarie, 1 person was from Sydney's inner west, 1 person was from southeastern Sydney, and one person was from Sydney's eastern suburbs, and one person was from Dubbo, and one person was from Batemans Bay. There was a gentleman in his 40s from Western Sydney who died at Nepean Hospital. He had underlying health conditions and wasn't vaccinated. And the two people from southwestern Sydney who died acquired their infections at Liverpool Hospital, a man in his 60s and a woman in her 90s. And two people died at home. There was a lady in her 70s from Batemans Bay who died at home, had received 2 doses of the COVID vaccine, but had only just received the second dose shortly before her death, and she was diagnosed after her death. And then there was a gentleman in his 40s from Lake Macquarie who had underlying health conditions. In terms of sewage detections, New South Wales Health's sewage detection program has indicated positive test results from Dearton in the far west. Now, there is a possible source of someone who's resolved the infection, but as you know, you can shed for a period of time. But we are still wanting that community to be on high alert and get tested. South Grafton in the Northern Rivers region, we have no known cases, so we do want the community testing rates to increase there. Jindabyne did trigger in the sewage, and we have identified a case overnight in Jindabyne, but again, please be very alert in that community and come forward for testing. And Maruya on the far south coast, to date we have not had a known case. I would like to urge everyone to get vaccinated at this time. So if you are still unvaccinated, please, there is increasing supplies of Moderna at pharmacies, and the GPs have strong supplies of Pfizer. So anyone over 12 years of age, regardless of your age, please go forward immediately, book in an appointment and get vaccinated.
Good morning, everybody. I just also want to express my sympathy to the families and friends of those people who have passed away. And again, until we're in that situation, we don't know how one feels, but it's certainly a terrible situation for each of those. So each of those people, each of those families and friends. So my strong condolences to each of those families and friends. We're going to go through some of the cases that we've had in the regions. I want to emphasise the reason I'm doing this in detail is that people in our regional areas must understand the importance of getting tested and getting vaccinated. Vaccinations are the way out of this issue. We've seen a dramatic drop in the expected cases that we were going to have in parts of New South Wales, particularly in Sydney, and that's because people have gone out and got vaccinated, but also people have continued to be tested and empowered our public health units to be able to determine where the challenges are. So as I read through these cases, I just want people to be aware that if you are in these areas, if you have any symptoms at all, or if you've been in any way close to the locations or close contacts of people that have been identified as cases, you just must go and get tested. I'll start with the northern New South Wales. To 8 p.m. last night, we had 2 new cases. One was in the Kyogle area and one in the Byron Bay area. Both people were infectious in the community, and again, that emphasises the reason why you've got to go and get tested. We had a Queensland truck driver who tested positive in Tweed Heads, and he's been out and about in quite a few locations. So he's obviously been in Tweed Heads, Byron Bay, Ballina, Coffs Harbour, Kempsey, Port Macquarie, Taree, Newcastle, Erina and Sydney. And in Sydney he's been in a few places as well. He's been in Narrabeen, Collaroy, Manly, Freshwater, Brookvale. So people need to be on high alert in any of those areas. That gentleman, by the way, is now in our special health accommodation. Illawarra cases. In the Illawarra, we've had 94 new cases reported in the Illawarra Shoalhaven. That brings the total in the Illawarra Local Health District since the 16th of June, since we had this outbreak, to 1,365. I think that emphasises the need to be very cautious through the Illawarra Shoalhaven. There are 66 cases from the Wollongong local government area, 16 cases from the Shell Harbour local government area, 9 cases from the Shoalhaven local government area, and 3 from the Kiama local government area. Up in the Hunter, there were 55 new cases across the Hunter New England local health district to 8 p.m. last night, and this takes the number of cases in that region to 837 since the 5th of August, which is had their first cases up there. 18 were in Newcastle LGA, 12 in Lake Macquarie LGA, local government area, 11 in the Cessnock local government area, 9 in Maitland local government area, 3 in Port Stephens local government area, 1 in Singleton local government area, and 1 in the Mid-Coast local government area. Now turn to the Central Coast. There were 23 new cases reported on the Central Coast to 8 p.m. last night, and that brings the total in that particular local health district to 677 since this outbreak. In the western part of New South Wales, across the Western New South Wales local health district, there were 24 new cases to 8 p.m. last night. This brings the total numbers in that local health district to 1,240. The ones that made up the 24 were Wellington had 16 cases, Cowra had 5, Oberon had 2, and Walgett had 1. Down in the southern New South Wales local health district, we had 18 new COVID cases to 8 p.m. last night. And again, that brings the total to 150 since the start of this current outbreak. Of those cases, of the 18, 2 new cases are in Goulburn, 9 are in Queanbeyan, 1 is in Googong, 1 is in Jindabyne, 1 is in Cooma, 1 is in Narooma, 1 is in Dalmini, and 2 are in Batemans Bay. The Snowy Monero local government area, we've had 2 more cases reported in that area, 1 in Jindabyne and 1 in Cooma. The Jindabyne case works in a local hospitality venue, and he's been actually active in the community. So again, people need to understand the need to be getting tested for any symptoms, or if you've been anywhere near this particular person or any of the venues that have been highlighted down there, and also, of course, get vaccinated. The Murrumbidgee local health district, we had 2 cases reported overnight, and they're currently in the Wagga Wagga base hospital. Far West, in the far western region of New South Wales, we had 5 new cases last night in the Far West. They're all in Broken Hill. Again, I just want to emphasise the importance in that area of also getting tested and getting vaccinated. And finally, on the mid-north coast, we had 3 cases reported in the Kempsey area overnight. Those numbers will be included because it was after 8 p.m, so they'll be in tomorrow's numbers. 1 case is a healthcare worker and has been in health accommodation in Port Macquarie while infectious. So obviously we're looking at those issues. Again, can I just emphasise, get tested and get vaccinated. Vaccination is the way out of this current issue in New South Wales, and being vaccinated is the single most important step you can take to protecting yourself, your family and your community. And please, 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 get advice from a doctor. Don't get advice from social media. There are an awful lot of very strange people on social media doing very strange messaging, and it isn't designed to keep you either healthy or alive. Thank you.
Premier, given the Health Minister has confirmed yesterday that businesses won't be obliged to or fined if they don't check who's in their premises, and given the fact that police have said they won't be policing for unvaxxed either, is it fair to say that Freedom Day for the unvaccinated isn't December 1 but October 11 like the rest of us? No one's watching them.
Not at all. Please be assured that, in fact, these discussions are ongoing in government. But as was the case before Delta, there is a very obvious onus on the individual to make sure they do the right thing. There are fines of $1,000 every time you do the wrong thing. Businesses, there are fines from $5,000 all the way up to $11,000 and closure for a period of time if businesses flagrantly disregard the COVID safety plans. And that might mean not even having displayed a QR code or not having done the basics. Let there be no mistaking that we expect everybody to do the right thing. And in the main, New South Wales has been outstanding at that. It's only a handful of people that choose to disregard the law, and given by the time that we open up even at 70% double dose, we'll have around at least 9 out of 10 over 16-year-olds with at least a jab. I'm very confident that the system will work well without giving any burden, putting any burden on businesses. And my message to businesses is this: we put out our 3-stage roadmap to give everybody certainty, but also to reassure you that our expectations are pretty much what they were pre-Delta, and everybody coped really well. The New South Wales government has provided a lot of support through Service New South Wales, whether it's directly interacting with the business or providing opportunities on how to get QR codes and all those things. And nothing changes except for the fact that there'll be an extra onus on the individual to demonstrate they're vaccinated. And obviously for a very large venue with hundreds of people in there, we would expect a staff member to be checking that as people come in. But for very small premises, that expectation is less. And I just want to stress to everybody, we've worked together before in the last nearly 2 years now, and I'm confident that'll continue to be the case.
Will businesses face fines, Premier? Will businesses be fined if they let in unvaccinated customers? Because yesterday Minister Hazzard said they wouldn't be.
Well, obviously our expectation is that everybody do the right thing, and we believe in the main that's what will occur. But if you're a larger business, there is an expectation that you stick to your COVID safety plan and do the right thing. And obviously individuals have a role in this as well. But it's in all of our interests, because if you have an outbreak in your premises, you will temporarily be shut down, and that will cause you to be disrupted. Our aim now, as we open up, is to actually have continuity, to have certainty, not to have businesses have to shut down and reopen all the time. And that will be prevented when everybody does the right thing. And I know in terms of reputation, even though you might not want to do anything wrong, certainly having an outbreak on your premises is not good for business. So we think there's incentives there for individuals and businesses to do the right thing, and I'm confident that business, individuals, community and government will continue to work together as we open up. I'm very excited by what the next couple of months brings New South Wales. It's also the most challenging time for us to open up and maintain the case numbers or the hospitalisation so that we're not overwhelmed. It will always be the challenge. It's always this fine balance between freedoms and business being allowed to do what they do, but also making sure our hospital system isn't overwhelmed. And I can assure you that our regulators, our police and business leaders are working together to make sure that we get through this period as best we can.
The police have said that they won't be checking individuals inside businesses, and you've only got 200 compliance officers in liquor and gaming, so they can't be everywhere in the state every day. How is that going to work? We're just not going to check unvaccinated people?
Well, not at all. We had provisions in place prior to Delta, and it's no different from individuals checking in with their QR codes, making sure that they're doing the right thing, but also that businesses aren't flagrantly disregarding their COVID safety plans. What's worked very well is that our compliance officers have done spot checks on businesses. In most instances, businesses, for example, satisfied 8 out of 10 COVID safety plans and then were supported in getting them completely done. So this is about working together to make sure that businesses and individuals support one another. All of us, the good news is that we're all in this to succeed. We all want to succeed. We all want to do well. We all want to have as little disruption as possible. And I'm confident that this will happen. And sure, people can talk about the exceptions and what may or may not occur. Let's see what happens once we open up on the 11th, because I have inherent faith that it's in the interest of businesses, individuals, community and government for all of us to do the right thing.
What's the situation in Byron Bay? They've obviously just come out of lockdown. Does this new case send it back into lockdown? And are the 7-day snap lockdowns in the regions enough if it's going to be open, close, open, close?
Well, a couple of things there. Firstly, we always rely on the health advice as to whether a region goes into lockdown. Secondly, all those situations kind of extinguish on the 11th of October. So then it becomes really about vaccinated people and non-vaccinated people. So from the 11th of October, the stay-at-home orders are lifted across the state. So that puts us into a new phase, a different phase of looking at the way in which we're dealing with COVID, and I want to make that clear. So there'll be much more certainty from the 11th of October because it will be more about individuals exercising freedom who are completely vaccinated. And again, I want to remind people across the state, especially in the regions, that if you're not vaccinated, you will go backwards. If your business doesn't have employees that are vaccinated, your patrons aren't vaccinated, you won't be able to operate. And so just a warning to everybody in the regions, please make sure you get yourself vaccinated if you haven't already, because you could very well go backwards from the 11th of October. We've been very clear about this point, and I just stress to everybody there is still time to get in your first shot and then your second shot, because ultimately we don't want to see seeding anywhere, including in the regions, and that's why only the fully vaccinated will be able to participate in business activity and obviously hospitality at that time.
The risk to businesses. Will a business have to shut down if a case tests positive inside the venue from October 11?
Well, we're obviously going through those details. As I explained a couple of days ago, in the Doty report, there's clear guidelines about what tracking, tracing, isolation and quarantine looks like. We're going through all those issues, and obviously it depends on the type of business and how large the business is. But when you have the vast majority of your adult population vaccinated, it does change how you track and trace and isolate people and what's regarded as a close contact. So Health is going through that difficult process and advising government. Obviously, we'll provide that information to the public. But we should all assume that if we are at a venue where there's been a case and we're at the venue at the same time, that we'll be required to isolate for that 14 days, and we should also assume that the business will be temporarily shut to do a deep clean. But can I just make this point that there is some detail around this which Health is still providing government advice on, and we'll make that information clear. But it also goes to schools. For example, we expect there to be cases in schools, regrettably. Does it mean the whole school shut down or just a year? So we're going through all those processes now, and we'll give the community good advice ahead of that.
You just said that people who are at the venue at the same
care visits, the announcement say, will residents in aged care centres also have to be vaccinated, and are children included in that to visitors?
I'll ask Dr. Chant to correct me if I'm wrong, but it's essentially everybody involved has to be fully vaccinated, and it's 2 per day. So obviously children under 12 are excluded from that.
Is there any consideration to opening them before October 25, given the improved vaccination rates, and if not, why?
No, we've been looking at the schools for a couple of weeks now in terms of the opening date, and our aim is always to provide certainty, but I will foreshadow that we've been reviewing on a daily basis what potential there is to get kids to school earlier. So I don't want to say too much until we've landed on a position. Parents should assume it's the 25th of October, and if there's better news than that, we'll certainly convey it. But I do want to stress that we are carefully considering the options we have to get kids to school earlier if we can.
Because on that, Premier, and that's important here, because obviously October 11, a lot of parents going back to work, opening up those businesses, the hairdressers, whatever. What are they going to do with their kids?
No, exactly, and that's why we're looking at those issues. It's fair to say that we didn't expect to have hit 70% double dose on the 11th of October. So we are considering what that does for the school system. But as you appreciate, our school system in New South Wales is huge. We have to look at the teachers that are vaccinated. We have to look at the stage return. There's a lot to consider, but I do want to openly and transparently say that we have been looking at this issue, and if there's anything we can do in that regard, we'll certainly announce it to the community. At this stage, parents should still plan for the 25th, but we are looking at options there if we can bring things forward.
On the close contact issue, so if you go to a restaurant or you're at a hairdresser and someone in that hairdresser or restaurant tests positive, even if you have a negative test and you are fully vaccinated, the expectation will be 2 weeks isolation?
Yeah, well, what I'll do is I'll ask Dr. Chant to answer those questions. Health is still going through all of that and to give us good advice, but it's fair to say that the definition of close contact will be changed once you get to 70 and 80 and 90% full vaccination. So I'll ask Dr. Chant to comment on that because it is a specific health issue.
So we are formulating our advice to government on that, but I can talk in general terms about some of the concepts that we're grappling with. So clearly we're going to be factoring vaccination status into whether you even fall the category of a close contact, and we have also been factoring in other protective measures. So for instance, if we know that people are wearing masks indoors, we can assume that that provides a layer of additional protection, and even if a case is positive and they've been wearing a mask, that provides protection. So we will tend to be providing businesses with sort of a matrix which takes into account various areas. We will obviously be more concerned about some settings. So some settings like healthcare, disability, aged care, we may take a more precautionary approach because obviously we're very concerned about the complexity and the consequences in those settings. But in other settings, it may be that we assume when everyone's vaccinated that you've been knowingly taking that risk, that we really don't do the same sort of level of contact tracing that's been occurring perhaps in the earlier phases in the outbreak.
So if you're vaccinated and you go to a pub, person at the next table over test positive, you might not have to quarantine.
I'm saying that we're working through those issues, but as case numbers rise, to some extent the onus will be around a little bit more about personal responsibility. You need to protect yourself with getting vaccinated. In a world where COVID is endemic, you need to take into account that you could be exposed, and you need to assess your own personal risk profile. If you've got underlying medical conditions, if you've got concerns and have not been able to be vaccinated due to an underlying medical condition, even if you've got a medical exemption and you're permitted in those settings, you need to take your own decision about the risk that is afforded. We're also learning much more about the vaccination and whether when you're vaccinated and you do get breakthrough infections, whether you're less infectious, which we believe, and maybe a shorter duration of infection. So all of these factors are being considered now as we update the community on what contact tracing looks like at 70% and 80%, but I'm just wanted to talk in general about some of the context. It will change.
I know you've got a lot on your plate, but we're supposedly opening in 10 days' time. And there's a lot of businesses out there who say it's going to be unworkable if all of a sudden all the staff have to go off for 2 weeks because someone inadvertently walks in positive.
My comment would be to all businesses, and this will be the setting. All businesses will be having indoor mask wearing. All businesses will be having fully vaccinated staff. And can I just, in terms of hospitality or new businesses that are opening and permitted at 70%, those strategies and having those COVID-safe tea rooms, those COVID-safe plans will really protect you from having anyone off. Now, if there is an outbreak amongst staff in those facilities, then obviously that will ratchet up our response again. So the best thing business can do is make sure that you've been fully vaxxed, but you continue to make sure that staff are diligently wearing masks and that they're also not congregating in any other informal settings which pose the risk of transmission.
Just on the contact tracing, sorry, you mentioned that it might be kind of scaled back. You've got a lot of surge staff on at the moment. Will they be coming off, and when, if that does occur?
I think it's not about scaling back contact tracing. It's around us focusing on what is the best way in which we can support a reduction of disease transmission in the community. So it will really be the prioritisation, and this has been an ongoing process where we've had to determine where best to allocate our resources. Now, the key message is that if you are a case and you have COVID, you will be required to isolate for 14 days. We still will be asking the community to get tested, and I hope we have changed fundamentally the view that people go to work if they've got a sniffle, a sore throat and runny nose, given the fact that we've progressed so much around working from home technologies. Some of these changes have really seen flu, influenza plummeting and many other viral infections, and some of those changes that we've put in place for COVID will be hopefully with us into the future as we try and get to this state where we mitigate the consequences of COVID through vaccination.
So, just for example, if you're at a pub and you've got people drinking inside, they've obviously got their masks off. You're saying that it depends on this matrix of the particular settings inside. So people drinking inside with masks off would put them at greater risk of being shut down than if it's a different setting? 'Cause businesses are trying to work out what the risk is so they can stock up.
The main issue is keeping your staff safe. So what we've seen is most of our outbreaks in business settings, and that's our experience recently because we've got a number of the high-risk venues closed down at the moment, is really what happens is if your staff become unwell, what happens is you get staff infecting other staff and that can amplify the infection. Now, we've mitigated that by having fully vaccinated staff, and the vaccines are highly effective, and what we need to do is proportionately assess what the risk to anyone else is in those settings. So we'll be looking more about outbreaks, multiple staff members being sick rather than an individual staff member. But my clear message is now is the time to make sure that your COVID safety plans are really robust, that you don't let your guard down. I mean, I've been into many premises where people are wearing masks that are down over their nose and mouth. I mean, now is the time to work together to really do everything we can to be very vigilant as we open up, and the more we can actually maintain some of these simple measures, they can have a dramatic impact on transmission and allow us greater freedom. So really this is a shared responsibility, and the community has a choice, as does industry, about how we work together.
Is New South Wales Health still projecting...
With the focus being, it seems, more on preventing outbreaks within staff and hospitality, and this is more a question for the Minister and Premier. If we're not fining businesses if unvaccinated patrons come in, are we fining businesses if any of their staff members are unvaccinated when they need to be?
I just want to stress the point that anybody who flagrantly does the wrong thing will be fined. Anybody who flagrantly disregards the health orders will be penalised. I want to make that very clear. There are penalties for individuals, there are penalties for businesses, but there's also a degree of understanding. And when our regulators pre-Delta went round to businesses, on average, we found businesses, there was a 10-point checklist. On average, businesses were doing 7 or 8 out of things right, and perhaps a couple of things they needed to improve. Now, that didn't involve a penalty, that involved supporting the business get those 10 out of the 10 things right. And obviously, some things have more impact than others. And as Dr. Chant said, the priority of every business should be to prevent their workforce from getting COVID, because we know that the highest incidence of transmission has occurred between workers and then workers passing it on to patrons, and that's always been the fear for us, and we just ask all workplaces to take that into consideration. As Dr. Chant also said, Health is finalising their advice they'll give to government about what guidelines will provide business, but I want businesses to be assured that what they'll be asked to do isn't very different to what they were doing pre-Delta. Not much has changed, because the onus will be on individuals to prove their vaccination, and obviously the Service New South Wales app, we're working really hard. The Feds have just given us their data to incorporate into our app, and Minister Dominello's team are working overnight to literally get that app up and running as soon as we can. We hope it'll be ready for the 11th, but if it isn't, there's obviously proof of vaccine through Medicare app, and then obviously checking in through QR code. So I just want to make it very clear that what we've done in putting forward our roadmap is giving businesses a very clear indication as what they can expect at every stage, what they can expect over the coming months, and also expect what they need to do to keep their workers and their premises safe. But there are very difficult issues which Health will provide us advice on regarding close contacts and workforce issues regarding employees. So there, the information we'll convey to the public as soon as we have it available.
Premier, tomorrow's the first.
At the back, you haven't asked a question.
Premier, tomorrow's the deadline for healthcare workers to get at least one vaccine dose. I think on the latest health figures, there's still 6% of the workforce that hasn't got a dose. That's thousands of workers who are going to be out of the system. What plans have you got to cope with that? And is the private sector going to have to come and help?
Yeah, I'll ask Minister Hazzard to add to my comments. But as you said, I think we've got 94% already vaccinated, which is a very good number. Minister Hazzard, do you want to add to that? Or yeah.
Look, I was asked the same question yesterday, and I'll repeat the answer. We are obviously concerned to make sure that health staff who are looking after patients and working with other health colleagues undertake their duty of care to both patients and colleagues and get vaccinated. I want to thank the health staff right across New South Wales. There has been an amazing response, as you'd expect from medical professionals. The latest advice I have from New South Wales Health is that as at September 30th, we expect 97.5% of the staff to have complied with that requirement to keep patients and their colleagues safe. The other 2.5%, No doubt that includes people who might have a different view, but it also includes people who are casual, who haven't been available to have a scrutiny by the health system yet. It includes people who have immunodeficiencies. It includes people with a range of issues why they would genuinely not have had the vaccination yet. So I've got to say I'm enormously thankful as the Health Minister that our doctors, our nurses, our allied health staff, our cleaners, our administrative staff, everybody who has anything to do with looking after patients and working with colleagues has been very responsive, as you'd expect, because they work in a science-based medical environment. They get the fact that you don't get onto social media, or most of them get the fact that you don't get onto social media. You don't listen to the rubbish that's on the social media. They listen to science and they've responded very well.
What are you going to do with those that 2.5?
What happens to them though? Obviously they're stood down without pay, is that correct? And then are they eventually put in what, an administrative role?
For the very small amount of people that are in that situation, obviously health would look to see if there were other available opportunities for them, but in all likelihood, as I said yesterday and I've said many times, there won't be a position available for them in New South Wales Health. Pretty simple. If you don't care enough to get vaccinated and look after your colleagues, if you don't care enough to look after your patients, then you probably shouldn't be in the health system.
Premier, can I ask about the disaster payment?
Sorry, I'm just going to go to Jess and then I'll come to you. Yep.
Sarah, when kids' indoor activities,
Sarah, I apologise.
When kids' indoor activities can resume, we're getting lots of questions from dance studios, gymnastics, indoor sports. The roadmap at 70 says non-vaccinated young people under 16 can only go with members of their household, so that would rule out any sort of dance class scenario. When can they come back?
Look, we're working on a number of those issues and we should be able to give some clarity in the next few days on those. We're obviously enormously pleased at the increasing numbers of vaccinations and people still getting vaccinated. So we're looking at what the surroundings are, how those surroundings might work. There are some facilities, I mean, I know there's some discussions, for example, about indoor pools at the moment. I've said a number of times that we're concerned to make sure that particularly youngsters, older people who need swimming lessons can have them. They can have them in outdoor pools at the moment, but we're having those discussions about what sort of environment would you need in an indoor pool to still keep youngsters who are not yet entitled or able to have a vaccine, keep them safe. And again, we'll be making some announcements on that very soon. These issues, as someone said earlier, I think it might have been Chris, there are a whole lot of issues currently on the plate of Dr Chant and the entire government when it comes to these issues, and we're trying to manage them. And I think so far the response has been pretty well.
Obviously the federal government today has said that 70%, 80% they're going to slowly start taking it away. You comfortable with that, given that we're not going to be at full capacity for businesses and some people won't be able to work?
A couple of things there. Firstly, Treasurer Perrottet is talking to our federal counterparts in relation to those matters. We want to make sure obviously that businesses remain a going concern, but we're also getting good feedback on the likely pent-up demand there is and the fact that everybody will be out perhaps over-patronising in midweek than what previously occurred. So we're watching the situation very carefully, making sure that there's enough support there, but also making sure that we allow businesses to do what they do best. And I just want to commend and thank businesses who've held on by a thread literally during the last 3 months. But obviously we're looking at those issues. I can't guarantee anything at this stage, but our Treasurer Perrottet is discussing these matters with our federal counterparts. And I just want to reiterate that we took a big but important decision to make sure that we allowed our small business grants and disaster payments to go to anybody across the state, not just those who lived in those COVID hotspot areas. And that was a decision we took, acknowledging that many tourism operators, many other businesses who relied on people coming and going were impacted. So we feel proud of the fact, and I know not everybody will say we did enough, but we feel proud of the fact that we extended that support to everybody across the state while we could. And now that we're starting to open up, we really need to consider where our resources are needed. I suspect we'll have a much more targeted approach because the business community is so diverse. Businesses range in size and what they're doing. Some have weathered the storm really well and done really well, and others haven't. So I think going forward it will be a much more targeted approach, and that's the issues that Treasurer Perrottet will bring to Cabinet and will consider. But certainly we've started conversations with our federal colleagues. But I suspect it will be a much more targeted approach because we want to make sure we help those who genuinely need it. but obviously looking forward to allowing businesses to get on with it and do what they do best.
Job saver then, the 50-50 agreement between you and the federal government. What's going to happen for that? Have you got a plan for that going forward?
Well, they're the conversations we've started to have with the Commonwealth at the moment. But as I said, it's really about, I think, moving forward, having a targeted approach to support those who genuinely need it. And obviously, from the 11th of October, I suspect the economic predictions about how we'd come out of lockdown 1 in New South Wales were more pessimistic than actually what eventuated. So I'm hopeful that the pent-up demand from the last quarter will actually allow businesses to get on their feet perhaps more quickly than they anticipated. And what is important is some of the questions you've been asking today about business continuity. What happens if there is an outbreak? How do we deal with staff? These are some difficult questions Health will provide us with final advice on, but I think that's what we need to turn our attention to. What we know now is the settings that business has moving forward, but the challenge for all of us is to maintain business continuity, maintain staff being able to turn up every day, and they're the difficult matters we're still getting advice on. But I want to assure the community that the New South Wales Government will step in where we need to, but that's the ultimate question, where we need to, and I suspect it will be a much more targeted approach, but again, they're discussions which Treasurer Perrottet is having with our federal colleagues, and obviously Cabinet will consider those matters.
The hospitality booking limit, the hospitality booking limit is at 20 people for October 11. 20 people can go to the park together and do whatever they want outdoors. Why can't more than 20 people in the one group book at a table at a COVID-safe venue?
Because between 70 and 80%, we do still need to exercise caution, and if 20 people don't necessarily know the 20 people sitting next to them, there's less likely to be mingling between the two groups. So it's still important between 70 and 80% to ensure that we prevent any virus spreading. And that is based on health advice. We know that the virus spreads more quickly in indoor settings, and by limiting a cap on bookings for that interim period, at least we know that, you know, for example, if you had an unlimited booking, chances are everybody at a party or a gathering would know each other, and that would be more lend itself to the virus spreading. So all these decisions are based on the best health advice we have, and I appreciate some people will ask questions about those things, but please rest assured that we've looked at everything in a context, we've looked at everything as a package, and I think the pathway we've led forward for the 3 stages of reopening is a good one, a sound one. It's not perfect, but no system is, but I believe we'll stand our state in good stead. And, you know, I've seen and observed what happens in overseas jurisdictions when you move too quickly, and we certainly don't want to fall into that trap. It's finding that right balance of providing freedom and business reopening with not overwhelming our hospital system, and they are the challenges that we have. And I'm more than happy to be criticised for those decisions, because ultimately our job is to keep livelihoods going but also keep people alive, and we don't apologise for that.
I'll follow up on that quickly. So on the roadmap, right, indoor swimming pools won't be opening until December 1. They're classed the same way as brothels and nightclubs. Does that make sense? Why can't indoor pools open at 80%?
Well, that's based on the health advice. If Dr Chant wants to answer that question.
So obviously the roadmap is the roadmap, and there's a lot of detail that we will continue to flesh out about it. There are settings like indoor pools, but the behaviours and the things that happen in indoor pools are very different. If you've got a group of 12 to 15-year-olds that are swimming in lap swimming in an indoor pool and they're fully vaccinated, then that's a very low-risk situation. If you've got a situation where you've got lots of young children in an indoor setting, sharing change rooms in that setting, close contact, that's a risky setting because children are not vaccinated under 12 years of age. So if you look at the roadmap setting, and I suppose I apologise if this hasn't been drawn out a lot, what we're trying to do is keep as many unvaccinated people out of indoor settings. And so the reason that children are permitted to go in and sit with their parents is that the parents will be vaccinated, and the children will be there. So again, there's less likelihood of the child amplifying the infection to the adults, because the adults will be infected if they've picked it up, for instance, at school. And then the other context is that grouping is less likely to be having a large proportion of the proportion of the children, or the proportion of people, if we limit it to 20, means that there's only at any one time going to be a small proportion of unvaccinated people in indoor environments. That's why we've removed those for outdoor environments. So what we are trying to do is a very cautionary opening and trying to remove the opportunity for people that unvaccinated people to be in higher risk settings, which is indoors. This is not perfect, and as we cast our eye over all the settings and all the different use cases, we will work through those issues. So I just ask the community to bear with us as we try and equilibrate, but that's the rationale behind some of those issues.
Can I just ask quickly too, while you're there, vaccinations, the federal authorities are telling us that they're finding that bookings are very rapidly decreasing. Are you still getting good, strong bookings, and are you still confident about that prediction of yours of 92%?
I'm actually going, I want to edge it up to 93%, and I think New South Wales can do it. So it's all right. Keeping on being very greedy. Look, naturally we are seeing that when you do lots of first doses, you have to do second doses. So on average, we are still, though, getting around 40 to 50,000 people coming forward for the first dose every day. And so that, I would believe that by next week we will see 90% first dose. And the question for us as a community is how hard and how high can we go? And I want to see that first dose continue to increase. I particularly want to call out to the community to really ask your network, your social network, who hasn't been vaccinated. And if it is because they're finding it hard to get transport to a location, if they're finding it hard to navigate a booking system, if they've got a disability and are finding it hard to wait online, please help them get a booking. There is pharmacies where you can book for Moderna. GPs have an increasing supply of Pfizer and obviously AstraZeneca. Please help each other get vaccinated. I don't want to leave anyone behind as we get that target of 92%, because the question I'll always raise is when we get to that 92% and 93%, who is in that 7% that hasn't been vaccinated, and is it because they haven't had enough access? And I've got to say a big thank you to our services. Our districts have been doing pop-ups, working with community leaders, doing door knocking and very intensive vaccination in vulnerable settings. And I just want to acknowledge the work that pharmacists have put in, that GPs have put in, but also our local health districts who have been doing such important work in reaching our most vulnerable communities.
Well, if there was a vaccine rate, when we get to that 1st of December, would there be a vaccine rate that you're not comfortable opening up to everyone at? And if there are areas, say like Byron Bay, which is still lagging well behind that state average, would you be recommending that they hold off on letting everybody vaccinated or not be able to go out?
Look, I think it's too soon to speculate. I think it's important to note that government can set the parameters, but really it is very much a partnership with business and the community. As we open up, can I just suggest, and this is my strongest public health advice, is that you enjoy the opening up, but you do limit the number of new people you come in contact with. What we need to do is just in that cautious reopening between 70 and 80%, importantly try and reduce the number of people we interact with, because we want to still maintain that at a limited number.
Dr. Ken, if I can just follow what the Premier was saying about lockdowns post-October 11. So are we ruling out any localised lockdown, even of a rural and regional town that has an outbreak, past the 70% roadmap?
I don't think we rule out anything in a pandemic, and I think the Premier's been very clear about that. But I think we have a different context. So just to be clear, we will have to understand that the context then is that if there is a cafe, if we're concerned about lockdown, and what we do in lockdowns is often close hospitality venues and other things, we have to take into account that the only people permitted in those hospitality venues will be vaccinated people, and the only people serving in those hospitality venues will be vaccinated. So it's just one additional control that we have in place, and obviously we need to reflect then on what's proportionate response locally when we have cases or increasing cases. And what we're also seeing is that we're seeing sometimes outbreaks driven by particular activities activities, though they might be workplaces, or they might be going through a particular vulnerable community, or they might be in social housing. And therefore the response we would put in place would be much more targeted to addressing those reasons for the outbreak. So it may be a more whole of government welfare, vaccination, testing package than it is for a lockdown. So we just need to take into account the new settings that will exist after the 11th of October.
Just one for the Premier.
Just on the aged care visit change. Obviously, you said two vaccinated people can visit. Are there any other rules in place? Do they have to all stay, in a particular room? Do they have to wear masks, or is it up to the individual care
So
providers?
we're going to develop some guidance in with aged care facilities, and we're also recognise the importance of younger children being able to visit. Obviously, they can't be vaccinated, so we're also doing some guidelines that we'll consult with the aged care facilities about are there settings or ways in which those visits can occur outdoors, or are there other safety measures we can put in place. So this announcement is very much in recognition of the heartfelt desire of the community to reconnect with their loved ones in aged care, but just to let you know, we will be providing some guidance about how that can be safely done. Obviously, masks will be worn indoors, and as we move through the various phases, we'll just have to reassess our risk.
Premier, just quickly on net zero. Why commit to upgrading a target? What's it difficult to get the Nationals on board? And do you think the federal government should do the same?
Oh, look, we're really pleased our government's moving forward on this matter. I think we're moving in touch with community expectation and making New South Wales a primary place for investment. This is all about doing the right thing, but also all about growing jobs into the future, and we've been very open about that. I'm just deeply grateful that we're a united team on this very important issue.
Why do you think that you were able to get the New South Wales Nationals on side for this target, that federally that party is struggling so much to...
Oh, look, I can't comment on those matters, but obviously when you're leading a state, it's very different to having to lead a nation where the views are more disparate. So in New South Wales, I think the vast majority of our population is very comfortable with what we're doing. You'll always have people that won't agree with everything you do, but I think in the main we are very much in touch with what our community expects of their government. But it's much more challenging when you have to manage the entire nation, and I don't envy the Prime Minister in that task.
On the Victorian border, this is now the third day in a row we've had fewer cases than Victoria has. You've made it clear that you'd like them to reopen the border, but have you had active discussions with Daniel Andrews about this?
Yeah, I was asked this question earlier today, and I actually want to give the Victorian Premier a few weeks before I have these conversations with him. I've been through what he's going through. It's very scary when the case numbers are going up. You're not quite sure when things are peaking. So I think he'll be in a position to have those conversations in a few weeks. So I'll leave him to manage the delicate situation down there for now. But I think it's in the best interest of our nation and our citizens for New South Wales and Victoria to move forward together, and I'll have those conversations with Premier Andrews in a couple of weeks. But obviously our thoughts are with Victorians. We've been through that difficult phase of still working out when things are going to peak, and I wish them well, and looking forward to having constructive conversations moving forward when I think Victoria and New South Wales together represent about 65% of the nation's population. I think it's in everybody's interest for us to move forward together, and after the next few weeks are over, I'll definitely be having those conversations with Premier Andrews.
The Victorian government, which has in many ways taken a bit more of a cautious approach to Delta than your government, has extended its travel restrictions to 15 kilometres from today. Why are we still at 5 kilometres, and are you considering maybe extending that before October?
Look, every state has had its journey on the COVID journey, and it's fair to say New South Wales has been very consistent in what we think. New South Wales has been very consistent in what we believe are the right settings moving forward. As I've said to the community, I appreciate we all want those freedoms, but they're literally around the corner. It's really good to be able to say in less than 10 days we'll have all those freedoms that we've missed. But as we keep saying, please exercise a degree of caution, in particular between 70 and 80%. There'll be around a 2 or 3 week gap between 70% and 80% double dose, but the pleasing thing is when we open up at 70%, we're likely to have at least 90% of our adult population with 1 dose, and if the 12 to 15-year-old trends are anything to go by, the vast majority of 12 to 15-year-olds will already have received their first dose by then as well. But I think it's important, I always say to people, judge us by Christmas or judge us early in the new year as to how we've done the last, reflecting back on the last 6 months, and I believe the path we have forward is the best one for New South Wales. But also, interestingly, whilst we've been very cautious in not not calling that we've gone through our peak during this most recent outbreak. We'll be entering that that reopening stage when our case numbers are declining. So it's much more challenging when your case numbers are going up and you face the prospect of reopening. So I think when anyone's making comparisons, they have to take all of that into account and be a bit sympathetic to what people are going through. And it's fair to say that it wasn't very pleasant when everybody was piling on New South Wales, and I don't want to inflict that on anybody else. It's a very, very horrible situation to be in, very difficult to make decisions which impact lives every day, and all I have is sympathy and empathy for other states going through this.
Fair to say short, sharp lockdowns are over? We just know that
I'm
after work.
not going to comment on that. I'll let others comment on that. But all I will say is I hope the people of New South Wales in good time will appreciate that, rightly or wrongly, every time we made a decision, it was in the best interest of our community with the best information we had. And looking back, I'm grateful for the great expert advice we had, because, again, it's too early for us to make assessments or commentate, but in a few months' time, I hope we all look back and think, gosh, we got through that really difficult period together, intact. And I'm just saying to all those people who are doing it tough, because I know a lot of people are, it's literally opening up is literally around the corner. Hang in there, less than 10 days to go. And I think all of us have a list of what we need to do in that week, especially reconnecting with our loved ones. I think the disconnection has been the biggest challenge for all of us, and reconnecting will be a priority for all of us in that week. Thanks, everybody.
Thank you.